Most people think liposuction and tummy tuck give same result. Reality is very different. Almost every week, some or the other patient walk in with the same confusion. Doctor, I want a flat stomach, but only with liposuction. And others say, Doctor, tummy tuck nahi chahiye, scar bilkul nahi chahiye. But actually, they are expecting results of tummy tuck. Liposuction and tummy tuck, although they sound similar, but दोनों बिल्कुल अलग काम करते हैं. एक फैट को टारगेट करता है एंड दूसरा स्किन एंड मसल को. और इंडियन बॉडीज में क्योंकि हम थोड़े स्टॉकी बिल्ड होते हैं, ये डिफरेंस और भी इम्पोर्टेंट हो जाता है. सो टुडे लेट्स कीप इट वेरी सिंपल एंड क्लियर. लाइपोसक्शन कब करना है, टमी टक कब जरूरी होता है, और सर्जन का रियल डिसीजन फ्रेमवर्क कैसे काम करता है, especially for Indian scenarios. Let us start with liposuction. What liposuction can and cannot do. Liposuction is a fat removal procedure. It removes stubborn fat and gives you a better shape and contour. जब muscle and skin अच्छे से tone होती है तो liposuction can give you a good result. But most of the patients do not know this limitation. Liposuction removes the fat, but it cannot tighten the sagging skin. It does not repair muscle separation. It cannot take care of sagging, which happens after the pregnancy. And stretch marks? Liposuction cannot address stretch marks. So if your main concern is fat, liposuction works beautifully. But if you have skin sagging and muscle weakness issues, liposuction alone will always underperform. If liposuction could fix everything, my job would be much easier. Now let's move to tummy tuck. When a tummy tuck is a right choice, a tummy tuck is chosen when the problem is not fat, but the skin and muscle. This is most common after the pregnancy scenarios. Indian women typically have two very specific patterns. One, a C-section scar which creates a fold or a shelf. 2. Muscle separation after the stretching caused by pregnancy, which pushes your stomach out and gives you a pot belly appearance. In such cases, if we do just liposuctions, result will look incomplete. Fat तो कम होगा, पर skin and muscle वाला gap वैसे ही रहेगा. A tummy tuck typically removes the excess skin, repairs the muscle gap, and also takes care of the C-section shelf. So the simple rule is liposuction is for fat, tummy tuck is for skin and muscle. और जब तीनों issues एक साथ हो तो combination approach सबसे अच्छा result देता है. Now let's look at the Indian specific factors. Indian factors that influence the decision. Indian patients में कुछ common specific patterns होते हैं जो कि इस चीज के decision को influence करते हैं. जैसे कि पहला, बहुत सारे इंडियन फीमेल्स में सिजेरियन सेक्शन के स्कार के नीचे एक शेल्फ सी बन जाती है जो अकेले लाइपोसक्शन से एड्रेस नहीं हो पाती. दूसरा फैक्टर, स्किन लैक्सिटी. प्रेगनेंसी के बाद लूज हुई स्किन को लाइपोसक्शन एड्रेस नहीं कर सकता, उसके लिए टमी टक जरूरी है. तीसरा फैक्टर, फैट डिस्ट्रीब्यूशन. हम इंडियंस यूजुअली लोअर एब्डोमेन और फ्लैंक एरियाज में फैट डिपॉजिट कर लेते हैं. यहाँ लाइपोसक्शन अच्छा काम करता है, प्रोवाइडेड यू हैव अ गुड स्किन. चौथा फैक्टर, muscle separation. Even lean women can have big muscle gaps which cannot be treated with liposuction. यहाँ tummy tuck जरूरी है. So these 4 factors together will decide if you should be treated with just the liposuction or you require tummy tuck for the solution of your concern. Safety, downtime, and realistic expectations. Both procedures are safe when done in the right setup. Liposuction has a shorter downtime, while tummy tuck takes little longer to recover because it addresses skin as well as muscle. Expectation setting is extremely important. Liposuction addresses fat and reshapes the contour. A tummy tuck flattens the base, improves posture, and gives you a long-term, competent core strength. Most of my patients say, Doctor, I want a flat stomach. But a flat stomach depends on structure, not just fat layer. So, correct procedure is equal to correct result. Let me now share with you the decision framework we use in our clinic. The surgeon's decision framework. 1. If the primary problem is fat, choose liposuction. 2. If the primary problem is skin and muscle gap, then choose tummy tuck as a procedure. 3. If fat, loose skin and muscle gap, all three are a problem, then combination approach gives the better result. This decision is not about choosing a cheaper or a easier option. It is about choosing the option which will actually give you the shape you desire for. Body contouring बस fat removal का topic नहीं है. It is about the entire structure of your body. And that's why आपका fat, आपकी skin, आपका muscle, ये तीनों मिलके आपको आपका desired result दिलाते हैं. So if you are planning a body contouring, थोड़ा टाइम निकाल के अपना ही स्ट्रक्चर एक बार समझ लीजिए. Correct choice will always give you more natural, more subtle and more long-lasting results. Comment questions below. I'll help you understand what suits your body type. अगर ये वीडियो हेल्पफुल लगा तो चैनल को सब्सक्राइब कीजिए, वीडियो लाइक कीजिए और शेयर भी कीजिए. मैं रेगुलर वीडियोस बनाता हूँ ताकि आप लोगों को प्लास्टिक सर्जरी के डिसीजंस क्लियर और सेफ लगे. आई एम डॉक्टर गौरव and I'm here to keep it real.